deeply focused. This training is really deeply focused on the administrative aspects, how to become a Medicaid provider, how to be enrolled in the Medicaid program. Our partners at Amerigroup are also going to be a part of sessions, particularly I think we might have seen some people from Amerigroup in the chat, but they're also going to be presenting in other sessions because you're going to be interacting with Amerigroup. Amerigroup's role is the third party administrator. So they approve people for being eligible and enrolled in FCS services. They're who you send your bills to, and they're the ones who pay you for delivering these services. We're going to talk about all those administrative aspects, but I just want to highlight so much other work that's happening both across the state, in your communities, in your programs around best practices. But this is very, very administratively focused. So thank you all for that. And just getting an idea here. And then Amanda asks, is the course solely for FCS or is applicable for other billable services? It's absolutely applicable for other billable services. What I will tell you is that the level of detail we get into for FCS services, this is how your payments rate are structured. These are your HCPCS codes, all of those different kinds of things. You do this work through Amerigroup. That is going to be FCS focused, but particularly this session, how to become enrolled in how to become a Medicaid enrolled provider through the Healthcare Authority. That's relevant to everybody who wants to do any other services as long as they're billable Medicaid services that are covered by your state's Medicaid plan. So good question and glad you're here. I think with that, we go to the next slide, and I believe I hand it over to Rayanne for the we talked about our team who's doing this. I want to talk about who on your team also needs this information. So we're not doing the structure for this particular academy. We're just sharing all of the information about the program. But in other academies, we often ask people to think about a team, because if your agency is really going to go all in and offering FCS services, you really need people thinking about it in a couple of different ways. You need your executive lead, you need a who can make the decision maker role. You need a program lead, somebody who understands how the program operates day to day, who knows the people you're serving and understands what their needs are and how we need to work with them. You need a fiscal lead, somebody to make sure nobody goes into this work to get rich, but everybody does need to get paid. You need a fiscally sustainable program as well. Yes, recordings will be available, and long term, our goal is to put recordings up. Thank you, Ava. You've got that one. So fiscal lead, you want to build you want to build a fiscally sustainable program, and then a quality lead. Doesn't matter if you can pay the bills if you're not offering a high quality service. So think about, if you're a large agency, you may have somebody who is you may have unique individuals for each of these roles. If you're a smaller agency, you may have one person who's doing ED roles and program roles or fiscal and quality roles. But think about it we'll talk about the lenses on this, and think about at different times what we say. What do we need from a decision maker perspective? What do we need from a program perspective? Maybe the program person says we need to do A, and the fiscal person says we need to do B. How do we resolve that? How do we share those? How do we have a dialogue around that to build? Because our goal here is a fiscally sustainable quality program. So that is who, if you're thinking about it from a team perspective, you want on your team as you're moving towards Medicaid billing for FCS services. This is also not a slow process. We estimate that it takes anywhere from 12 to 18 months for an agency to go from, hey, I should be billing Medicaid for these services, to actual building and sustaining programs. So know that that's part of your planning process, the amount of time this will take, because you will learn a lot here, but you will also learn that Medicaid is complicated. Partly why it's so good that we're going to have recordings and tools and materials available on the state website is no one's expectation is that you're going to understand everything coming out of any one of these trainings. If you get 2 or 3 good nuggets, then that's awesome and we'll feel like we've succeeded. But when you get to the other steps in the process, you may be involved in provider enrollment right now. And so today is going to be really helpful to you. And you can't even see billing off in the distance, but you'll have that training, you'll sit through it, you'll hear a couple of terms, you'll learn some terms, and you'll be able to go back to it when you're in the middle of it. That's also our goal with these trainings, really to support you through this process. Because as I said, from initial, we should do this, to we're doing this in a fiscally sustainable and quality manner, is commonly is about an 12 to 18 month process that we found. Shorter if your agency is already billing somewhere for some service, but still a long-term process. So lots to learn. Come away with a couple of learnings each day, each session, etc., and know that all of the materials will be there for you to go back to when you hit those stages as well. Right, so next slide, please. Now I can hand it over to Rayanne. Sorry about that. I just was so excited to get to you, Rayanne. So we want to have some welcome from the state of Washington.
Hi, Marcella said, I'm Marianne. I'm the Foundational Community Supports Program Manager, and I'm just honestly super excited to see all of you guys here and really to give some context to this. That you know, Foundational Community Supports is relatively new, right? We're on a waiver, we're doing a demonstration, and the need for the Medicaid Academy really came out of providers saying, "Hey, we don't understand," or "We need some help here," or "Maybe there's some support here," right? This program is really reciprocal. The more information that you give us and give the trainers about what are the needs, what are you seeing, the better that we can use our technical assistance dollars to help support you. So this is one of those kind of wonderful things that the Corporation for Supportive Housing is really good at, and we were able to offer. So as someone who was a provider in the past and walked through the Medicaid process, I can tell you the first time that I attended earlier this year, I learned, a good notebook full of things. So I hope that you guys have a very similar experience through this process and ask lots of questions and really rely on, there's some technical assistance time available, and just are open to what some of those opportunities are so that you can set your program up with the best foundation possible. So I'm really excited that you guys are here, and please reach out if you have any questions throughout the process, and I'll put my email in the chat as well in case you have any additional questions outside of kind of the Medicaid Academy role and specific things about FCS or those trainers.
And this slide, which we will be making available to all of you, and I sent the slide decks out this morning as well as on Friday afternoon, so you should have that, does include Rayanne's contact information. So you have access to that, but Rayanne, as she mentioned, will also put her contact info in the chat.
All right, that is awesome. All right, let's talk about the purpose of the Medicaid Academy sessions, what we are and what we aren't. Let me also just highlight again how complicated but not impossible to master the Medicaid program is. One of the pieces we'll have is that, and one of the things you'll learn is that even with Rayanne and other leaders from the state here, you may ask questions that we can't answer right now. And so we take that, we put that oversight on an FAQ, we do some research. Maybe it's a policy question the state hadn't considered, and so the state's going to have to figure that out. Maybe it's something that's very much in the weeds at Amerigroup. We're going to have to get the right Amerigroup people to tell us. So know that no one knows everything about the Medicaid program. I promise you, it is huge. It is very, very different in all 50 of our states and 6 territories in our country. Our purpose here in the Medicaid Academy is to help you think about and give you enough information about the program that also in some of the TA and other efforts that we have to think about, okay, how are we going to implement this program in my agency? How are we going to bill? How are we going to track our information? How are we going to enroll in the program? Whose job is that? All of these different pieces here. The state has said, and this is standard for every state, this is not just Washington, but every state, the healthcare authority provides the what, the policy requirements. In order to bill FCS, you have to do A, B, and C. We're here to help you think about how with A, B, and C, what does that mean for our agency? We want you to develop a plan for your agency to be able to implement this in a long-term and sustainable manner. One of the state's goals has been very clearly to increase supportive housing capacity across the state. There are many, many people sitting on wait lists, not even able to get on wait lists, part of our coordinated entry systems. Housing unstable in our community, we know they need supportive housing in order to address their needs. We just don't have enough supportive housing across our communities. And so one of the state's tools in order to increase supportive housing capacity and build new units of supportive housing is to have Medicaid fund the services. Medicaid's an entitlement program. If you meet the criteria, you should be able to access the services. Those are 2 really big shoulds in our community, but let's see there. So we're here to help you take all of those pieces and think about how do we do this in our agency in order to address the community needs we're saying. Each session will you'll learn some things, you'll have tips and tools, etc. You'll have opportunities for sharing things across the agency. We'll get coaching for your agency, and there will be links throughout. I just want to highlight 2 really important links: the state's website on Foundational Community Services, or FCS, and then Amerigroup as your third-party administrator. Remember, you may be intersecting. As an agency who's delivering foundational community supports, you're probably mainly going to be working with Amerigroup and your Amerigroup lead in order to implement FCS, and they're there to help support you, especially if you're an agency for whom this is your first Medicaid service. That's really why the state put together this third-party administrator model. So Amerigroup also knew that that was partly their role, that they're bringing the housing resources to the table. They know how to work with folks in their community. They have all these other skill sets, but the administrative piece of Medicaid may not be your agency's strength. That's partly why we're here with this training, and that's partly a lot of resources and support that Amerigroup can do as well. So they give us, I like to say that the state gives us the what, and we help you with how you're going to do the what in your agency. So next slide, please. Next couple of slides are all about the Medicaid Academy and getting you oriented to this. We're here today for session 1, provider enrollment. We're going to talk about participant enrollment. So there's enrolling your agency in Medicaid so that you can bill for Medicaid related services. And then there's enrolling your people, the people who are eligible for FCS, and making sure that they are enrolled. Medicaid makes a distinction between eligible. I have all the characteristics of a person. I have a low income, I have a disability, I'm aging, I'm pregnant or parenting, all the reasons why I'm eligible for Medicaid. And then, but if I'm not in the state system and said, oh, Marcella's Medicaid's on in Washington State today, then I'm not enrolled. And you can't bill for services for somebody who's not enrolled in any given day, even if they have a need, even if they're completely eligible, you have to get them enrolled. So we're going to talk about agency enrollment today. We're going to talk about participant enrollment later. We're going to talk staffing models and budgeting. We're going to help you give you some tools to help you figure out what's your total cost of care. What do you need to be paid in order to do a quality service? We're going to have a question and answer session on the 20th for the first 3 sessions. And then the second 3 sessions are policies and procedures. We'll have a template for you for that, so that if you're building out your FCS policies and procedures, we've got some help there. We're going to always the most exciting session, documentation and billing. People want to know how they get paid, and Amerigroup will help us with that. And then finally, in the last session, we'll talk about quality. Last didactic session, we'll talk about quality assurance, quality improvement. How do you ensure a quality program? And again, tools and materials that you can adapt for your agency. Our goal is to have you download them, change them, whatever works for your agency, but it's always easier to start with somebody else's work than an absolutely blank page. And then we will end in early November with a final Q&A and technical assistance session. Throughout, we want to hear from you. We want to hear how this is helpful. We want to hear what else it is that you need. We'll probably be doing these again throughout 2023. And so we want to hear what makes it helpful and anything you would change as well. Always looking for your feedback. So that is our schedule for our time together over the next 6 weeks. So we're going to talk about orientation. This is again talking what Academy is, and then we're going to get deep into the provider enrollment process. Very first step of delivering a Medicaid billable services is getting your agency. So skip the next slide. I think we've got unfortunately too big a group. Yep, and then we're going to go to organizational capacity. So think about what's impacted at the agency level when you become. There's a couple of different lenses we like to say that you think about becoming a Medicaid provider. This is things that may or may not change for your agency as you begin to make this shift. The goal is if you're delivering quality supportive services, supported employment services, supportive housing component, we really want the transition to FCS to be minimal. If you're starting from scratch, that's always easier. If you're making a transition to your current residents and how you bill services and deliver services, that's also, there's possibilities of potential here. But you have to think about it with a programmatic lens. What do people need in order to get and keep jobs, in order to get and keep housing? That's the function of our programs here. And what staffing and training, what supports do we need? Who does that work? Who does that direct care work? What training do they need? What support do they need? So there's a programmatic lens here. There's a strategic lens. You're looking to grow your agency. You're looking to address community needs, et cetera. So you think about business partnerships. You think about long-term planning. You think about what do you do best and where do you need partners? This work is too complicated for, I think, any of us to do it all best. My role at CSH is as the Medicaid expert, and somebody starts talking to me too deeply about housing, and I'm like, hold that thought. Let me get you the right right person who knows more of those pieces. I can talk it at the very highest levels, but when you get into the details, development, finance, all of that. So it's really important to think about what partnerships you need. That's just an example of, knowing your strengths and knowing your weaknesses and making, creating a network that helps you strengthen your weaknesses. Think about strategic long-term planning. Your agency may have a strategic plan, they may be developing one, et cetera. How does offering FCS services fit in? As Amanda's question earlier, are there other Medicaid services that you think you could do really well for the people you serve in your community? Are you from a rural community where not a lot of people offer these services? They definitely need more. Are you from are you from a more urban community? We've got a lot of providers in in urban communities, yes, but they may not be culturally specific, and that's a particular lens we bring. So know your strengths, know your challenges. Next slide. Next slide, there we go. Know your strengths, know your challenges, and build from there. Think about it from an analytical perspective. What data do you capture? What data do you need? How do you assure quality programs? And how do you ensure that you've got the data and reporting that talks about, that tells the story of your quality programs as well? And then logistics. Who does your fiscal operations? Who does your legal agreements? How do we look at from an HR perspective? How do you actually get in the weeds and make this happen? We're saying that when you're shifting to Medicaid, you're going to have to think about what's the changes and what's the transition plan for all of these lenses. I will say most commonly, agencies often will either hire a new person to um, shall we say, gently move the agency in that direction. Often that person like reports to a COO or a CEO of an agency. And that's often your beginning stop as somebody who's building out these plans, who's helping your agency lead and make that transition. It really needs to be sort of one person as the sole point. They're not going to be the experts on all of these lenses, but they're they're going to need access to the actual experts in your team who think about things through all of these lenses. So next slide, please. So I talked a little bit about tools, and we've got a couple of tools that we're going to share with you, but I believe Eva this morning shared our work plan. In different other Medicaid academies we do when we've got everybody's part of a strict team, their goal is to build out a work plan. In this, we're not doing this now, we're just sharing the information, but we also want to share the tools. Feel free to download the tools. People often ask us, or is it required for us to use those tools? CSH has no authority to require anybody to use anything. These are here to help you. We want you to have access to them. We want you to adapt them in order to make the changes you need in your agency to be successful in delivering FCS. So we have all of our materials on what we call our own SharePoint. After today, you're going to get an email inviting you to join our guest directory, meaning you'll be able to access the materials that we're going to post up. There's a process here, and Eva sent you these slides, so you'll have these examples as well. Please accept the invitation right away. It might take 24 hours to get the file sharing confirmation, but we're going to have all the materials that we think could be most helpful to you up on here, and we'll talk about some of these tools as well. Again, download them, take off our logo, put on your logo, and make them work for you. If you've got any trouble with access, please reach out to Eva. But this is that process. So, and we will be building other tools as we come. Again, all part of orientation. Think about your team members, get at what's your end goal here. It's helpful to have that generic, I just want to learn more about Medicaid, but eventually you're going to learn enough that you're going to need a really specific work plan. Think about how you're going to build out that work plan, who's the team from your work plan, what skills you need of the team on your work plan, and no one person, I promise you, is going to have all those skills. So how do you build that team? How do you share materials in the shared work plan? How do you work with our shared materials, download them, try them out? How do you take advantage of the technical assistance and the materials we offer? Build your questions for our Q&A sessions. Ask your questions to understand where to focus your time. Again, I will just note, some of your questions will be able to say, nope, I know right away, you can't bill for travel. Sorry, but you can't, it's a federal rule. Most of your questions will take more detail than that. Can you invite another staff? You can absolutely invite another staff. And Eva, if you could put a link in the chat for what they would share with that other staff person so that they could sign up. So yes, the person who's taking over day-to-day billing, we definitely want them to come to session 5. But also think strategically. As you in the first deck, it has our schedule. We'll have that slide in all of our decks. Make sure that if you have a single point person in your agency working on this, you probably want them to come to every session. But you have somebody whose day job is just billing, they probably need to come to session 5. They might need to listen to today's session, but you might not need them more than that. So think strategically. Our feelings won't be hurt. We want to use people's time in the best way. And so it's important that you think strategically about what the topics are and who needs to learn the most of these topics. So yeah, so next slide, please. And thank you, Eva, for helping Sherry get the right people on her team here. So while between meetings, think about who's on your FCS team, what their skill sets are, how they're going to work together, what platform you're using to continue to work with a work plan or a Medicaid or Medicaid Academy, throughout the academy and beyond. Are you going to use you're going to use our work plan template that we give you, or going to use shared files? How do you bring your team together in a way that makes sense for your agency? And then what can the provider readiness tools teach you? Ava also last week sent out a number of what we call provider readiness tools. They ask anywhere from 5 to 10 questions on, does your agency do A? Does your agency do B? It's fine if all of your answers are no. What that means is that you've got a steadier climb to an agency who might have been able to answer yes to many of those questions. All of those questions and provider readiness tools that we shared with you all talk about things that your agency will have to figure out. How are we going to execute? How are we going to execute delivering services? How are we going to execute our budgeting process? How are we going to execute documentation, billing, ensuring quality? That's where our tools will come in, and that's where the provider readiness tools hopefully will get you to start thinking about that as well. So I'm going to take a breath. I'm going to take a little bit of water, and then I'm going to see if there's any other questions, but you guys have been great about putting questions in the chat. All right. So as we said, for FCS, for any program, the first thing is that your agency has to be enrolled with the state as a Medicaid enrolled provider. Gosh, what does that mean? I think I've got about another 20 plus slides to tell you what that means and to take you through the process. Next slide. So this is the big picture of how does it go from, hey, I should do this service, to actually contracting to do this service. This is what it takes to become a foundational community support provider. But in particular, Amanda, back to your question, this is what it takes to be a Medicaid biller in Washington State. 1, you got a plan. Preparing your agency, staff, residents, designate a lead staff person on this training. I have talked about that before. So build a plan, think about all of the information we're going to talk about here, and think about who in your agency is actually going to execute this. You need to get what's called an NPI. Medicaid is filled with acronyms. NPI stands for National Provider Identifier. If you just Google Medicaid and National Provider Identifier, it will give you that process. Basically, you need your agency's tax, EIN, and you need to, and this is going to be really important, you need the legal name of your agency that literally down to every space has to be accurate and correct, because once you put it on an NPI, you're going to be putting it on some other forms as well, and they all have to match for billing to go through. So you need to get a national provider identifier. That takes about a week or so for you to put that information in and get it back, often even less. If FCS is your agency's first Medicaid service, you need to complete the non-billing provider agreement form. There's a link here. It's HCA form 180008, and you email the form to HCA. We're going to have some more details on that later. For who you email. If your agency is for profit, you've got some other work to do. You need to complete the Medicaid provider disclosure agreement. We'll talk about what that's requirement, and ensuring that anybody who profits from your agency is not on what's called the exclusions database. People who committed Medicaid fraud in the past are no longer allowed, and been convicted of Medicaid fraud, are no longer allowed to continue to profit from the Medicaid program. Once you've completed the non-billing agreement form, you've sent that in. If you're for profit, you've done the provider disclosure agreement. We'll talk more about these forms in a little bit. HCA will send you, and this is the healthcare authority, not Ryan's team, not behavioral health, but the broader healthcare authority sends you a welcome letter with your agency's what's called Provider One ID. Provider One is the state's provider management system. So when the state comes out with information like, we've got 200 behavioral health clinics across the state. How do they know that? Because they pulled the information out of Provider One. Every agency needs to be registered with Provider One. That's the next step of the process. You register with Provider One as a new Medicaid enrolled provider, and you tell Provider One what services you're going to be doing, FCS housing, FCS employment, or any other services that your agency does. If anywhere in your agency is already billing Medicaid for any other service, you're part of a federally qualified health center, you are delivering targeted case management, you're doing any other services, these processes are probably already in place. And you'll have a process that you work with the people who handles this within your agency to say, okay, we're adding something else to our list of services that our agency offers. We want to add foundational community supports. Once you're registered for Provider One, you've got an NPI, you've got a Provider One ID, you've got your agency Medicaid related ID. Again, very, very important. You're going to need that agency Medicaid number for all of your claims and all of your billing. Then you're ready to be in touch with Amerigroup to begin their contracting process. You want to have a contract in place with Amerigroup. Pretty easy, simple process. More than anything, they want to know that you're registered for this service. They want to know that you're registered for Provider One. And then they want to know how they should pay you is really the biggest pieces of this contracting voice. So obviously really important to get this part down. And we've got a link here to Amerigroup's provider application. If this is all just seems so much, etc., HCA has also created a process outlined on that link. So this is the big picture. I talked about some really big things. I'm going to unpack many of these really big things in the next slide. Again, needing to do Provider One, needing to do the non-billing provider agreement, contracting with Amerigroup. This is all HCA's policy that they've put in place for this service. And now we're going to talk to you and really drill into it and think about, well, gosh, how do I do that? Let's see. Next slide, please. So this is just, I feel like, a really helpful slide of websites to bookmark because you're going to be going back to them again and again. You're going to have questions and you're going to want them. HCA's put together a Provider One for FCS Providers Explainer that we find really valuable and helpful. That non-billing provider agreement form we're going to unpack. You don't just sign it, you see what you're agreeing to and make sure that happens. The Provider One sign-on page, you're going to spend some time there. 10 points because it's just wonderful and helpful to the billing and resource guide. You're thinking, I've never billed before. How do I do this? Provider One tells you some of that. Provider One resources, user manuals, enrollment manual. And then this one's going to be really important to you. Really important information you need is going to be in the Amerigroup provider manual. That's going to give you some real details on exactly how you deliver services, what's required, how you make sure somebody's eligible and then enrolled, how do you bill. A lot of our materials we're going to talk through here came from that provider manual. So shout out to Amerigroup for that. And then finally, HCA on provider revalidation. This provider enrollment process lasts for a 5-year period, and 4.5 years from now, you're going to be looking to revalidate that process, i.e. you've done it. You have to be a Medicaid enrolled provider in order to be able to bill. If you let that enrollment lapse 5 years from you started it today, and 5 years from now it lapses, and haven't made sure that the enrollment is a continuous enrollment, then you're not going to be able to bill for those services you deliver on the day that the enrollment is lapsed. So we're going to talk a little bit about what's called provider revalidation. That's just 5 years down the road, going through this provider enrollment process again. Thank you. So provider enrollment is a separate department at HCA from Rayanne and Kimberly and the other folks that are part of behavioral health and part of FCS oversight. But as you work with them, it's really, really helpful to have Rayanne and her team in the state government because they can really, challenges you're having, they can really support you through that. So the provider enrollment system within HCA and every state that has a Medicaid program and every state has a Medicaid program is required to have a provider enrollment. They've got a data system. They verify enrollment and eligibility for all individuals. This person, this resident, this person experiencing homelessness, this person looking for work is enrolled in Medicaid, and they do eligibility and enrollment. They verify the agency status with Happily Help, meaning they verify eligibility and enrollment for the agencies, not just for the individuals. We've got separate sessions on each of these roles. They're a central place for information for providers, all of those different Provider One resources, all done by the provider enrollment team. And they make sure that we have an adequate network. Do we have enough doctors? Do we have enough? This is one we never can't find a community with enough child psychiatrists. Do we have enough social workers? Do we have enough counselors? Do we have enough people to address the needs that our population is coming to us with? And they're constantly working on making and building out their provider network in order to meet community needs. So it's a really, really important role. You'll also find from Medicaid, there's huge emphasis on preventing fraud and abuse. These are public sector programs. These are taxpayer dollars. They want to make sure they're only enrolling providers without a history of fraud or abuse. And they want a process to assure state compliance with the federal requirements. So there are a lot of federal requirements on preventing fraud and abuse, things that HCA has to do. And so they're often the agency or the department, shall you say, within HCA, the healthcare authority that does that fraud and abuse work. So provider enrollment are folks that they often really speak Medicaid, a very wonky Medicaid, and that's why I think it's just so wonderful that Washington set up Rayanne and Matt Christie and all of your folks in order to help you navigate from within state government. I think that's also a really important role, and why it's so great to have Rayanne and others here to help us. So yeah. So let's start that process. So think back a couple of slides to, oh, we've got like a 7 or 8 step process, but I didn't really understand. It said get an NPI. It said this. We're going to start to break apart these in the next section of our training here. So you do need a national provider identifier on an NPI. We've got a link here to the form. Here's how you apply for it. We have a link to the system. Once you filled out the form, here's where you upload the form to. As I said, you will need your agency's legal name and you will need your agency's tax ID number. It will also ask you for a 10-digit taxonomy code. For FCS, this code is likely to be, you should be using the code, the taxonomy code for case management, and that's that number here. You upload the form at the National Plan and Provider Enumeration site, which you have here. And Washington State's also done a video and a training on explainer on NPI as well. But these are the basics. You need the form, you need to gather the information. And again, let me just highlight how important it is that your information exactly match, because this is not the first form. This is the first form you may be doing to enroll as a provider. I promise you it is not the last. And these systems are set up all to talk to each other, and they want to make sure that everything matches. So that is just really, really important for your agency not to have trouble billing down the road. So you get an NPI number. Then when you have an NPI number, because this form will ask for your NPI number, you now complete a non-billing. I know that's confusing because you're definitely going to bill, but provider organizational form. We've got a link to the form. We've got a link to the process. Oops, we didn't change that. Ava, I think this is not the right slide deck because you're emailing the form now, I believe, to Matt Christie, matt.christie at hca.washington.gov when you've completed that non-billing provider form.
You're right. I inserted this slide.
Thank you, Scott. Thank you, Rand.
I apologize for that. I will make sure that it is updated and send this slide out
deck. Cool.
again to everyone else.
Cool. All right, thank you. So by signing this form, your agency is committing to some things, and your agency has this information: your federal tax number, the taxonomy code, you have an NPI. You are promising to follow all state and federal laws regarding Medicaid programs, including all the documentation requirements, checking annually that none of your controlling staff, this is people on your board, this is people in leadership roles, have been convicted for Medicaid fraud or abuse. You do that by checking on the exclusions database that is right here. You have to promise to keep your records for 6 years. You have to submit to any audits as requested by the healthcare authority. You have to become HIPAA compliant. Yes, we're going to have a whole section on HIPAA. I promise you. I believe that's session 4, session 5. I can't remember, but I promise you it comes. We'll unpack them. You have to keep HCA up to date on any material changes. So does your address change? Does the legal name of your agency change? Does your executive director change? Does your board change? You're going to have to you're promising to keep HCA up to date on that. You're going to have liability coverage, and the form tells you the rates of your liability coverage. And there are just a couple of other additional requirements. So look through this form, specifically and make sure that the things that you're committed to or your executive director is committed to by signing the form are all things you can do. I will say this list here, by signing the form you're committed to, are the really high level. Their agency might not already be HIPAA compliant, and now they have to become HIPAA compliant. My guess is if you're not Medicaid enrolled, you don't usually check the exclusions database. Now you're going to have to do that. You're going to have to build that into your policies and procedures. Whose job is that? How do we make sure that's done annually? So these are really the high level pieces of that form that you're going to have to do some thinking about, and who's going to do it, who's going to put, how do you put that on your work plan? How do you institutionalize it? When I use the term institutionalize, I mean, okay, somebody does it now. How do we make sure that next October or next September, somebody's checking the exclusions database again? Whose job is that? How do we put it on there? How do we get it on their job description? All of these things, this shift for your agency, if this is your first Medicaid service, will touch all pieces of your agency and all your different departments and staff. But you want to build a comprehensive work plan that makes this a seamless process and not so concerning, helping your staff know that this is a process that will build you into fiscal sustainability long term. It'll allow you to grow to serve community needs, and that's why we're putting this all on here. So thank you. Thank you for that, and thank you for the folks who put Matt's info in there. And thanks Eva for switching this. So once you have completed that, you get that request, you get that letter back from the HCA, then you're going to be logging into the Provider One portal, because that letter you get from HCA says, here's how you log into Provider One. I'm not sure it explains why you want to log into Provider One, but I promise you want to log into Provider One. You put in these applications. Takes about 30 days maximum for them to get back to you. Know that you are enrolling as a facility / agency / organization / institution. It's a multiple option checkbox, and that's the one that you check when you get into Provider One. You're enrolling under this category. So next slide, please. And again, always open for questions. So because you will be submitting data electronically, you are going to be covered by the rules. This is why you have to become HIPAA compliant, the electronic data interchange. You know what, I realize I'm not even explaining HIPAA. HIPAA is a law, a 1996 law. It stands for Health Insurance Portability and Protection Act. People usually use it in the healthcare world as shorthand for you have to keep information confidential. But really, HIPAA is about ensuring that HIPAA is about ensuring that your electronic data interchange is secure, meaning so if I'm sending what's called, we'll cover this in the HIPAA sections, protected health information, I'm sending Marcella's name and her social security number and her diagnoses electronically, we need to make sure that that information is secure, and the only people who have access to that information are people who need access to that information in order to assure that I get the care that I need and that I'm entitled to. So as part of provider enrollment, your agency, and before you get to this step, your agency has to think about how are you going to submit your information to Amerigroup in order to complete provider enrollment. Doing this electronically is called electronic data interchange, and it's highly what we recommend. There's some possibilities that you could maybe still do paper, but we really don't recommend that. HCA is required Amerigroup to continue to accept paper. It slows down your payment. It slows down many processes. If there's resources and you can think about how to shift to an EDI system, that's what we really recommend. So what are the options? How are you going to submit info to Amerigroup so that Amerigroup can pay you? So there are a couple of options. One is your agency has an electronic health record, an electronic billing system. If you have that, then those systems are able to create what are called FTP, File Transfer Protocol, 837P batch files that get submitted to Amerigroup electronically. Your agency may contract with someone else who has one of those systems, and you use them as a third-party biller. For provider enrollment, you're going to have to have made that decision. You should have a contract in place. Who's going to do your third-party billing, and then what is the system that they're going to use? Because working on the contract with Amerigroup and provider enrollment requires you to say, here's how we're going to do electronic data interchange. You might have another process with Amerigroup, such as password protected spreadsheets. At the end of the day, you're creating a version of what's called the CMS 1500 form. That's the claim submission form. 28, I think, different variables on that, some of with subsections, et cetera. We're going to, in the billing and documentation part of our training, we're going to take apart that form. You may enter directly into Amerigroup systems. You may enter directly information into what's called their Availity clearinghouse, but you're going to have a way. How do you get all of that information, say on a password protected spreadsheet, and then somebody does the data entry into the Amerigroup system? So you're going to start this process, there's going to have to be conversations, your fiscal folks, your leadership folks, your program folks, all going to need to be having conversations about how are we submitting our billing information and make some choices there. If you haven't done that, I highly recommend you wait till session 5. We're going to take apart some of these things and go into more detail in what I'm sharing now, but I did just want to start here. So next slide, please. So here's some required attachments for the non-billing provider. You need to sign something saying you're not employing anyone who's in the exclusions database. You're going to have to do that check. You're going to do a W-9 for your agency. That's the tax form. And then using the, you're going to know if you're using an electronic billing system, you're going to have made that decision. And then for that, you're going to have to complete the trading partner agreement, and you're going to complete what's called EDI testing. Hopefully, whatever system you use for billing, you're going to need to, hopefully that's a system that Amerigroup's already used to, that's the HCA is already used to, etc. People often ask CSH for recommendations on those sorts of systems, and you'll hear me say this again and again throughout the training. Don't ask me, I'm a consultant full-time. Ask somebody who has to live with these systems every day and see if these systems work for them. So if anybody, this is a point where we ask if anybody has an electronic billing system or an electronic health record that's really working for their agency, I would just love it if you put your name and your agency and what the name of the billing system is in the chat, because that is the kind of referrals that other folks on here should be taking. Yeah, most folks who recommend one billing system are selling that billing system, and so they're just you take that with a grain of salt. Their job is to sell the system. I respect that, and that's important for them. But I really want to hear from somebody who's using it every day, and is it really making the difference we need in their agencies? And yeah. So next slide, please. Lots of information. Again, any questions? Put in the chat, and anybody who's got a billing system they love, we always want to hear that as well. So the trading partner agreement, if your agency is using electronic data interchange, if you somehow electronically are submitting information and submitting your claims to Amerigroup, then you're going to need this trading partner agreement. If you're using a health record or a billing system, they have this, they do this all the time. It's a legal document on the HCA website. Couldn't get a link, but Google trading partner agreement, HCA, and you'll be able to download that trading partner agreement. If you've got an outside billing system, download that form, share that with them. And they and fill that out from there. John Grant's telling us the biggest problem with availability is they don't have a bulk data upload option. Suggestion on how to get them to create that feature. So I will say 2 things. 1, Rayanne, make a note of it, share that in your conversations with Amerigroup. 2, if there's anybody from Amerigroup on here, and I think I saw in the intros there are a couple people where, please take that request back. I think that's a really good point, John. A bulk data upload would make it much easier for providers there. Going back to the trading partner agreement, and thanks, John, great question. Going back to the trading partner agreement, the agreement sets the terms to govern all of your electronic interchange. You're going to need to look at that. Your IT people are going to need to look at that and make sure these are terms that you can live with. Your lawyers should probably look at that as well and make sure it's terms that they can live with as well. And it commits your agency to becoming HIPAA compliant in all electronic data. HIPAA compliance is a requirement of the FCS program. And as I said, I believe in session 4, we're going to go into more detail about what your agency needs to do in order to become HIPAA compliant. But it is not, I'm not saying it's a small hill, I'm saying it's not a big hill as a lot of people would lead you to believe. A lot of HIPAA is saying we care about client privacy, we are going to do these things to protect client privacy, and then doing them. And then being able to be audited and say, your policy procedure says you're going to A, show me you do A. That's a lot of HIPAA. There are more technical aspects to those systems, and I am not a tech expert. We have other folks on our team who could talk to you about that a little bit more if that's requested and needed. But again, your agencies are committing there. So, oh, no, we're ready to go. Next one. Good anticipation, Eva. So complete all the forms, do all this, put your forms together. You only have so long when you start pulling them up and pushing them up into provider one. So complete all the forms you get started, save it on one folder on your computer, and then when you submit all of them at one time. These may be things that are at your fingertips, or they may not be. So you're gonna have to get organized around that. And don't start your application until you have all of the pieces in place. Print the forms, sign the forms, scan them back in. Electronic signatures are accepted if you've got an electronic signature process within your agency. You could always Google any state forms and Amerigroup forms as well, but know that throughout our process, throughout the slide deck, you're going to have links. We checked all the links literally yesterday just to make sure they're all still good links. So you should have those as well. Thanks, Eva, for doing that. And before submitting the materials, check everything twice. Everything needs to be accurate. Every I needs to be dotted, T needs to be crossed. These are systems that are purely electronic oversight, meaning if your NPI says we're in suite 23, and if your Medicaid ID form says you're in office 23, and you think, hey, that's kind of the same thing. Isn't that the same? Nope, these systems are going to kick it back, say, hey, there's a problem, this doesn't match. So that level of detail is just really, really important. Check them twice, check them 3 times. If you don't, if you submit something that's incorrect, it goes to the state. It takes them a while for the state to figure out that this isn't right. It kicks it back to you. Hopefully the state's clear about what you need to change. It gets you involved in a process that probably takes too long. And so we want you to be able to get this all right. I'll just say it again. The legal name for your agency, the NPI application, and your agency's Medicaid ID all have to be match exactly in order for these processes to move forward. Again, just little details, but it's going to save you so much time if you could get that all right. So if you're a for-profit agency, one thing is you need to complete the provider disclosure agreements. If you're getting or making Medicaid payments totaling $5 million annually, you have to have policies and procedures that include information about the False Claims Act and other provisions named in the section 1902 of the Social Security Act. And the provider enrollment manual tells you how to report this information. I didn't see what sounded like many for-profit agencies, but know that in order to enroll in all those different forms we said you needed, this Medicaid provider disclosure form is also required only for for-profit agencies. So next slide, please. So claim submission information that you need at this point. You haven't delivered services yet, you haven't documented, but in order to bill, you're going to need this information. Amerigroup has it set up that you can submit claims electronically online at Availity. You can also check your claim status, so build yourself an account there, etc. We recommend that all of these systems often say, oh, who is the agency contact? We recommend that that agency contact not be an individual. We recommend that that agency contact be an email that is, admin@myagency.org. We just showed you a great example why. We had a slide that said, hey, send these forms all into Lisa Casacchio and she'll get them through ACA. That was true in the spring. It's not true in the fall. It now goes to Matt Christie. We don't want we don't want emails telling you what you need to do about billing or what you need to do about documentation or provider enrollment to going to a place where somebody changes. So set up within your email system a admin, billing, something at my agency, and then have somebody have it as part of their role to check it. And even if that person gets a new job and you get somebody else in that role, etc., you'll have a seamlessness with that email. So I think that's really helpful. Electronic claims payer ID for the clearinghouse, Availity, you've got the number there for that. You're going to need that. This is setting up with Amerigroup. If you're doing paper claims, this is where you mail them to. All of this is just completely lifted from page 7 of the Amerigroup manual, the Amerigroup provider manual, but you're going to need all of this as part of your enrollment submission process as well. So just make a note of that and make sure your agency's made these decisions and has the information here. A couple of times in this process, you'll say, hey, are you going to do A, B, or C? And you're like, I don't know what A, B, or C means. We'll try to give you those answers through that process. This is just one of those examples. If you're doing electronic, you're doing it through Availity. This is the payer ID. Next slide, please. So when you've submitted all these forms, as we said, your agency gets a welcome letter from the provider enrollment. It'll give your agency the provider 1 ID. it'll give you a copy of a Provider One user access request. Again, for Provider One, we also recommend that you use an email that is not an individual, an email that will be, turned off when a person leaves a job. You want an email that's going to be going for the end of time. So admin, billing, etc. Setting that up so that when Provider One needs to contact you about different key information, that you can capture that information. That email that you'll get from Provider One when you set that up will give you details about getting yourself set up in the Provider One system. Anytime you have to do any kind of provider enrollment, anytime you're doing you're adding a service or subtracting a service, any of that all goes through the Provider One system. So you want to have a clear pathway for Provider One to contact your agency and tell them anything you need to do in order to be able to keep billing and being paid for services. Remember, Provider One isn't really concerned with whether you've delivered the services. Provider One is concerned with whether they can pay you for the services. I think that's really important. So you're going to want to stay in good standing and good collaboration with Provider One. I also say that I noticed a couple of people who said they were from San Diego on this training, and happy to have you. Know that all of these materials are completely tailored to Washington State. So this conversation, for example, about Provider One and how the process is, if you're from a state other than Washington State, your state has a different process. Your state has a different, your state will have different forms, your state will have different ways to do things, your state will have different people in charge of things. So great to have you, but know that the high level, hey, I have to enroll as a provider, I need a W-9. Yeah, that's true in every state, but exactly what you do it and how you do it is going to be different state to state. We do these Medicaid academies, but we do them statewide because this is not the Medicaid Academy we would deliver, at least not the links and answers to questions if we were in Oregon or Idaho or California or any other state. So this is just specific to Washington State, though the processes will be each state will have its own process. And in California, each county will have its own process usually. So Provider One access. Your agency will use the welcome letter to create a Provider One account. There's also an explainer from HCA on Provider One access and really geared towards foundational community supports providers. So shout out to HCA for making something so specific to you all and something so in clear language, i.e. a lot of these systems commonly, what I like to say, speak Medicaid. If you speak Medicaid, that's great. But if you don't speak Medicaid, and if this is your first Medicaid service, you probably don't speak Medicaid, you're trying to learn. So HCA has done a really good job of building up materials that I like to say speak in plain English and tell you what to do here. And that's our role here as well. If I'm using an acronym, like I said, I used HIPAA too often and didn't explain it. So feel free to jump in with any of those questions. We can't get away with acronyms here. Next slide, please. Okay, so you have now gone through, you have an NPI, you have an agency Medicaid ID, you've got Provider One and your Provider One is signed in, it's going to your admin at myagency.org, etc. Now you need to, now your next form, remember I said, wouldn't be, NPI was the first, it wouldn't be the last form. I think this is the last form. Remember, all the info has to match, your legal name, your address, your telephone number, all of that has to match, which you put in all of your other forms. And then you're applying now to be an Amerigroup contracted provider. You're going to need that Medicaid provider ID number, which is what you got from that HCA letter. You're going to need the NPI. You're going to need the taxonomy code. You're going to need a facility or business license for your agency. You may have submitted that in some other forms. All of these things have to match exactly. By doing this, again, similar to what you did for the non-billing provider agreement, your agency is agreeing to follow all state and federal healthcare related laws, and it can take Amerigroup up to 30 days to get back to you. Amerigroup's been working hard to streamline this. I know in the spring, they said this process can be as short as 2 weeks. I don't know if we've got anybody from Amerigroup on here to tell us how's that going, or Rayanne or others, what are you folks hearing? Most of the,
sorry, Marcella. I was hopeful maybe Amerigroup could speak to it, but we've had a couple of agencies start the process and get through kind of the entirety of being able to bill. We've seen it take anywhere from like 4 to 5 months is probably the fastest that I've seen it from straight scratch.
That's helpful. That's helpful. But that's from, hey, I need to get an NPI. 4 to 5 months is I need to get an NPI till I've got an Amerigroup contract.
Correct.
Like all of those different processes. It's not like Amerigroup's taking 4 to 5 months to respond. I know that's not fair. Yeah, that would be right. It's all the different processes. So yeah, that's why we said it takes about an 18 months from, hey, we should do this to, you're fiscally sustaining. Just getting yourself set up can take as long as 4 to 5 months. So yeah, and doing these, and you'll notice that each of these build on the other. NPI comes first because you can't get a Medicaid ID number without an NPI. Amerigroup comes last because you can't apply to Amerigroup without having your NPI and having your agency Medicaid provider ID number. So all of these pieces need to be in place. Know that the slide deck will be up, the recordings will be up on the SharePoint that Eva is going to help you all connect to, etc. And then I would also say that not for this session, but for upcoming sessions, we'll have different tools to download as well. Can't say we've come up with a tool for how to do this because the HCA tools are really pretty clear. Does anybody have any specific questions? I'd love to hear in the chat where your agencies are in this process. Are you enrolled, or somebody in my agency is enrolled? I run the supportive employment program, but the behavioral health clinic is already enrolled. How is this working for you and your agencies out there?
I have a question.
Hey, perfect.
Hi.
Hi, Connie. Where are you from?
Cowlitz County, Washington. So I just submitted the application to get the Provider One number.
Okay.
And
perfect.
I have a question about, since I'm just right across the bridge from Oregon, the agency that we own, or nonprofit that we own, is in Oregon, but we do have a Washington address,
Okay.
to Washington address. So it's kind of confusing.
Okay.
So on the application, I had put the Oregon address because that's where the nonprofit that owns the one in Kelso is. Is that gonna kick it back, do you think?
Does the address match exactly with the Oregon address from the NPI to your Medicaid ID to Provider One? Is it this? Have you used the same address the whole place, the whole way through exactly?
I would have to go back and look somehow because I can't remember what I put for the MPI address.
So the fact that as long as those addresses match, you shouldn't have a problem.
Okay, so if I go and find the MPI address as the Washington address, then I should probably redo the application.
Yeah, I mean, if the NPI, or you may want to apply for an NPI in Washington State. Different agencies often have more than one NPI for reasons exactly like this. So as long as they all match across the NPI application and the Medicaid and the Amerigroup application, that's all good. It doesn't. Okay. I don't think they're going to check because it's a different state. I think what they're going to offer in the provider ID, they're also. I'm sorry, in the can't remember whether it's in Provider One or it's in this HCA system, but you're going to have to say, here's where we offer services. That's easy for agencies. You can just answer that. And obviously you're not telling, or at least you're not billing Washington State services in Oregon. So,
yeah, because we're doing business in Washington.
Exactly. You're doing business, you're enrolling as a Washington State Medicaid provider, you're serving Washington State Medicaid recipients. Yep, so that's fine. Shannon says we're already set up for Amerigroup Provider One and Availity. Congrats. I'd love to know, Shannon, how long did that take and what agency you're calling from?
I'm calling from Sound Pathways. So the Amerigroup was already set up before I came the program manager.
Okay.
So that was all done by our accounting people. Provider One was easy. Availity was a little more difficult to try to get signed up for. I actually had to go down and prove who I was and get a notarized thing from the bank. I don't know why, but so far, I mean, everything seems to be processing okay. There's been a couple of things that have come back from Medicaid, and it may be our inputting, information and stuff where we had to resubmit, claims, but knock on wood.
Yeah, that's great. That's great. Any advice for agencies that are just starting this process, Shannon?
I know that you talked a little bit about building kind of the team and who's going to be in that process. Like currently right now, I'm the only one doing the billing. because our accounting people, the guy who was doing it kind of stepped away.
Yeah.
And so it's always good to have a backup.
Yep,
You know, because
absolutely.
it's not my primary job. I'm the program manager for Amerigroup as well as another program, and it's very tedious work. It's not difficult. It's just
Yeah.
very tedious and time consuming.
And
So
you've got to get it just right. And it's not,
yes,
there's not
yes. If you
often a
mix- if
lot
you
of,
mix the
there's a lot
number
of
or
thinking.
anything back,
Exactly. There's not a lot of thinking. It could be A, it could be B. It's like, yep, Amerigroup's decided is A, you got to do A. If you do
yeah.
B, the whole thing goes back.
Yeah, exactly. So just make sure you cross train with some other employees
Yeah.
just in case.
Yep, that sounds great. So Katie Rain says they're enrolled. They have been using it. So we're excited. You're the new program administrator. You're going to, use this information to ensure we move forward and remain in compliance at STAR project serving Walla Walla and Columbia. So that's awesome. I'm so happy to see that. And then Suzanne's asking, what number do we call for questions for provider one setup? So Suzanne, it depends where you are in the process. You have to have an NPI already. You have to have a Washington State Medicaid ID. And then the letter that gives your agency the Washington Medicaid ID will tell you what to do for provider one. If you try to set up now for provider one, the provider one application, well, one, you're not going to be able to get set up. You're not going to be able to get an account in. But even if you got in, they would say, okay, tell us your NPI number, tell us your Medicaid ID number. And if you don't have those things yet, you can't really do anywhere. So this is really a step one, step two, iterative process. You can't do multiple things at the same time, because you do need all of the information. Each step gives you a piece of information that you need for the next step and that you can't complete the next steps. You've got the NPI, so that's great. I don't know if Suzanne, if you have the Medicaid ID number, but you should have gotten a letter from, and I think, go back a couple of slides. Eva, can you go back a slide or two? Let's see, not that one, that one. Oh, there we go. Oh, no, that one. Okay, that slide where it says initial review. Your agency should have gotten a letter like this that says, hey, you're started enrollment. Here's your NPI. Here's your provider one ID. All of that. Your provider one ID is what I'm also calling your state Medicaid.
Are you able to actually hear me? I'm sorry.
I'm sorry. I'm just hearing you now.
Okay, good. And this might not be the right format to bring this up. I just thought I needed to. We've been around for a lot of times here at Prosperity Wellness Center for many years. We already have the establishment into provider one and the NPI, all of that's done, but I have to change ownership within the system, and I want to ensure that it's done correctly. And I would like to walk through that with somebody on the phone. Is there a number that I can contact someone for assistance?
So you're changing ownership. You should have a provider one rep who could talk you through that, I believe.
Okay, I don't know of a provider one rep, so that's why I'm just wondering, is there one number
I don't have that. I don't know if any of the other providers who are already signed up here in Washington have that information, or it's something we can look for. Eva, if you can kind of put that as, one of our to the side questions.
That'd be fine. Thank you. Sorry, I don't know if this was the right format. I thought I would just
No. This is exactly the format. And even if we don't have the answers, part of what we want to do is drill down and get you the answers.
All right, thank you. Appreciate it.
But if any other agencies who already are provider one and you've been in this situation, you've been through this, please jump in and give Suzanne the answer. All right, we'll do some research and take a look at this. All right, so any other questions? This is exactly what we're here for. Great. Okay. All right. So one last piece of information, this isn't something you need today. This is something that you're going to need 5 years from now. Or if you're starting today, you're going to need 5 years from now. Let me say that. It's a state explainer on revalidation. It's what you did today for this process is not, in perpetuity. Every 5 years, you've got to tell the state, yes, this is still us. Yes, this is our address. Update the enrollment documents. You'll complete the organizational non-billing form. You're going to need the license number, all of this information on here. We recommend that about 6 months before your agency's validation and enrollment expires, you'll have an expire date. That's 6 months before you start the revalidation process. 6 months is an outside number. It usually doesn't take anywhere near that long, but I will also say that if your agency's enrollment expires and you deliver services the day after it expires, you're not going to get paid for those services. You've got to be an enrolled provider on the day that you deliver the services in order for Amerigroup to pay you for those services. So they're going to have access to that information. They're going to know if your enrollment is current and active or not. And it's going to be important for you to do that. So we don't want that happen to anybody. So that's why I'm like, hey, wait, do it 6 months. So like I said, if you're starting from today, 4.5 years from now, in order to do this. So that is coming. As we get to policies and procedures and as we get to work plans, think about where you're going to build that into your work plan. Again, not important today, but we don't want you to find out about it, 5.5 years from now when Amerigroup's denying your claims, which if you didn't stay enrolled, that's exactly what they'd have to do. So yeah, so next slide. So I think at this point, Rayanne, do you want to jump in and talk about some of this? DBHR is DBHR work here?
Sure, absolutely.
Yes, I know is your slide. Yeah.
So we have quite a few different offerings through the foundational community support team. And really, it's again, like referenced throughout, just really want to make sure that we're supporting the work that you guys are doing. So there's a newsletter that goes out, and that's really where we highlight anything kind of special or interesting that the team is doing, but also we highlight agencies and put some training information in there, like the Medicaid Academy, the Housing Institute, and funding opportunities all go in that newsletter. So if you want to click on that when you get these slides or when you look at them to register if you're interested. And then that calendar, that link to that calendar is again one of our links to a bunch of different trainings, but you'll see a foundational community supports tab, and that's really all the trainings that we offer that are scheduled, and the topics are picked really by the agencies. And we look every year and say, okay, what are we seeing across the board, and then offer several trainings. So we have at least a once a month housing call and once a month employment training that really kind of goes over the broad subjects, or how do you change in a system, right? How do you do that if maybe you are a case manager on a larger team? And then some of the other things, we have supervisor calls, learning calls, really support those mid-level staff, because we know that being kind of sandwiched in between can be a really hard space. So there's some particular trainings for those. And then anybody who is a FCS provider right now, or is going to be very shortly, there's a thing, so we do fidelity reviews, and that's something where we're saying, how close are you to the evidence-based practice of the service that you're providing? And right now there's currently some incentives for that. So if you're a provider and you wanted to participate in that, or you're interested in more information, please feel free to email me and I'll get you up with the right folks. And then if you would like to be on the listserv, for the emails for the training and things like that, it's not a bunch of extra stuff, but if you want training updates and things for your team, again, please email me with a list of emails, or email me yours, and we'll make sure to get you added to that list. Thanks for joining.
Next slide, please. There are also, as Rayanne said, there were also all of these different resources, all of the different pages and links. This is broader, as I said at the start. We're really focused on the Medicaid Academy, on the administrative aspects of Medicaid. This is really broader. You've got the SAMHSA evidence-based toolkit, you've got the pathways to housing and pathways to employment links. You've got much broader perspectives on this work. So, and again, there's Medicaid aspects to this, the administrative acts, third-party administrator, Amerigroup's page, et cetera. But there are other things that are broader than that. So it's really important. IPS Works, that's the place, SAMHSA best practice for supportive employment. If you're delivering supportive employment services, you definitely should be familiar with that page, et cetera. And then certainly all of our Washington State COVID response, because people are still getting COVID and people are still dying from COVID. So let's be working on keeping our communities and our people safe. Shout out also to the FCS newsletter. That's, I find, really valuable and helpful as well. Next slide is the contact info for the folks who are leading FCS. Kimberly Castle and Rayanne Orban are leading the housing related work. Darren and Dawn are leading the supported employment work. If you've got questions, if you're in the East, if you're in the West, they should also be helpful to you. Again, Medicaid is complicated. Medicaid is administratively complicated. Some of these questions have easy answers. And as you saw today, thank you, Suzanne, for your question. Some of them don't, and we're going to have to do a little bit of digging and find that answer for you. But the more we do this, the more we get all of the answers. So with that, our next session is next week, same time. We, or I should say, Amerigroup is going to talk about participant eligibility. And then in a couple of weeks, we will have a Q&A session. So bring any questions to the sessions that you want. But for each of our didactic sessions like this, we're going to try to focus on the topic at hand. So we're going to talk just about participant eligibility next week. If you've got other questions during the week, hey, I didn't ask X about provider enrollment. If you don't mind, hold that for the Q&A session on the 20th. And with that, I say thank you for joining us and spending time with us. Eva, Rayanne, Scott, I see you on here as well. Scott Tankersley, anything else we want to share with the team?
I think that this was pretty comprehensive. I would just want to open the floor one more time for any outstanding questions, since we do have a little bit of time. It looks like it is 1:48 or 1:48 New York time where I'm sitting. So that's actually 11:48 in Washington. So this technically was going to go until 12:30 your time, or excuse me, 10:48 in Washington, 11:30 your time, having some time difference challenges here. So we have a little bit more time. Happy to give you guys time back, but if there's any last questions, feel free to shout them your way. Marcella is a wealth of knowledge and you should take advantage of that. All right. Well, it sounds like everyone is feeling quite good about the material. As I mentioned earlier, I will be, oh, I see that Heather is raising her hand. Heather, do you want to go ahead and ask your question? You're welcome to unmute or put it in the chat, whatever you're comfortable with.
Good morning. I just have, just as we kind of wrap up here, I have a very general question. I'm from Bayside Housing and Services in Jefferson County, and I think there's at least one other Jefferson County person here as we get up and running on the county with permanent supportive housing services. So we're new to permanent supportive housing, just establishing our first program. We've been doing transitional supportive housing in this organization for 6 years, and we have other organizations in the community that have also been doing it and are getting into permanent. So I guess my question is just to kind of take advantage of this group, is one thing we're looking as a community about at what it's going to take to do this capacity building. And that's it's a really broad question, and I really appreciate this training as it gets our minds wrapped around that 12 to 18 month process, just knowing that it's a year to a year and a half realistically to start looking at all the things that it takes. At Bayside, we just finished the CSH Supportive Housing Training Institute, which was just mind-blowingly useful 5 months of training. So we're kind of coming off of that and looking at what it's going to take. So my question is around any resources that any other organization may have taken advantage of for capacity building. So for example, did you just kind of grin and bear it and build your team small to large? Did you reach out and find capacity building funds, for example? That's one of the things we're looking at is, do we go and reach out for just funding that would help us to do all of this capacity building, staff growth, training, building a property management team, policies, all of those things. So was that a clear question in there somewhere?
Oh, absolutely. So I feel like there is both a resources question you have and a financing question you have. So I put on, but if you've been through the Institute, my guess is I put on our training center. There's all of the resources you need in regard to best practices on property management, on service delivery, on housing development. A ton of that stuff is at our training center. You had a second question in regard to, gosh, how do we pay for all of this? Because we're not going to get paid for a while until we do this. So I'd love to hear what other agencies are doing. I will say What we're seeing nationwide is states are offering capacity building grants for agencies to help them make this transition. We're seeing philanthropy. Philanthropy often likes to be the starting money. They don't like to be the long-term money. So you may also be really helpful to be able to say, hey, look, we're leading, we're grasping towards a long-term sustainable plan, but we need help getting there. So that's another idea, but I'd love to hear what other agencies, if they've done in this space.
While other people are thinking, I just want to do a quick shout out to those of you who are here from Jefferson County, just to say that we're really interested in partnering in capacity building for PSH across the county and doing that together, applying for funds together and whatnot. So if anybody's listening, let's get in touch.
Definitely. And why don't you put your email in the chat if folks from a get in touch perspective. Oh, Brian says, get an account on webs, state funding opportunities. Thanks, Heather. This is
Webs. Okay, great. We do not have an account on web, so I will look into that.
Awesome. It's really just basically like a database that the state uses to put all of our funding resources in, and then agencies, you'll click kind of which categories you fall into or which ones are you interested in, and then you'll get alerts when funding opportunities come out. And so even like FCS ones or pregnant and parenting ones, those like broad categories, you'll sign yourself up and then you get those updates and applications and stuff. So I'll find the link real quick and add it to the chat.
Thanks so much, Ryan. I appreciate that. And thank you, Allison. We'll be in touch.
Any last questions or comments for the group or for anyone on this call? Well, you have all of our contact information. If you do have any other questions, do not hesitate to reach out. We will be with you for the next 5 weeks. We're so excited to work with you on this Medicaid Academy. You're a great group, and we can't wait to see you again next week. Like I said, if you have any questions, don't hesitate to reach out to Rand, myself, and we'll see you next week. So thanks so much, guys.
Thanks, everybody. You guys are all great.
Great training. Thanks so much.
Thank you.
Thank you.